I always like to share sort of how I got into this space. As a primary care doctor, I noticed that so many of my patients came in with the same constellation of illnesses: high blood pressure, diabetes, obesity. And it became clear to me that the only way to really move the needle on helping them improve their health was to get involved in ways that they could make healthy lifestyle choices outside of my clinic walls, because that was really going to be the most important driver of their health and the management of their chronic conditions. So I took off my white coat and stethoscope and started getting involved in community activities around making healthy lifestyle choices and found my way to Healthy Living Matters. It was before it was even called Healthy Living Matters. I joined the group of like-minded folks back in 2010 and have been involved with the organization ever since. So really a pleasure to be here with you all today. I think we're going to have a great time together. Really excited about our agenda today, and just some housekeeping. You can find in the chat the agenda and also bios for our speakers. But we are delighted to have Dr. Economos from the Tufts University School of Medicine, who's going to talk with us today. And Dr. Economos, I have to tell you, I remember reading Shape Up Somerville, and I know that you were involved in that effort, and really a testament of what communities can do. We're also going to have a unique wellness break during our time together that will get our blood pumping, get us out of our seats, potentially, unless you want to do it in your seat, but will also allow us to celebrate Black History Month in, I think, a really cool way. So I look forward to that as well. And then we'll hear from Partnership for a Healthy Texas about what we can continue to do to advance our policy priorities, even in this season between legislative sessions. So an exciting day today. Excitement that HLM has continued to do such amazing work for this many years. Really some great examples of community partnerships that have made changes to everyone's ability, especially kids and families, to live healthier lives, no matter where they live, what language they speak, what their socioeconomic status is. The key is really to change our environment to promote health and to make healthy behaviors the easy behaviors to choose. I would like to acknowledge all of the folks who are supporting this work on our executive and administrative team. Chris Brown is our chairperson, Lisa Helfman, our vice chair, and then there are 3 members at large. I am one of them, but we also have Marie Arcos and Adi Barkawi. And then I'd also like to welcome Dr. Erica Brown, who is new to the Harris County Public Health team and is our new project director for Healthy Living Matters. Next slide. This tells you just a little bit about who you are, and this is for folks on the call who may not be familiar with HLM, or this is your first time coming to one of our collaborative meetings. We really work to promote policy that addresses system level and environmental change, with the idea that we can then decrease the incidence of childhood obesity with smart policies. There are over 80 organizations and hundreds of individuals that have been a part of the HLM journey, and they help us promote these policy solutions. They serve as champions to continue to keep childhood obesity in our collective awareness, and to band together to actually make changes that are going to impact the health of our kids today and then generations to come, because they're starting off with a healthy life. Next. So the mission of Healthy Living Matters, as I mentioned, is really to affect smart, thoughtful policy change to improve the circumstances of healthy living for kids in our community and also their families. We have 3 big buckets of category that we focus on: eat, learn, and play. And we hope, again, to promote our policy priorities by really increasing those mobilized to do this work and advocating for this work. We want to take the opportunity to strengthen our partnerships. Certainly, childhood obesity is a really large issue and probably feels overwhelming for any one person or one organization, but together we can do amazing things. And then again, ultimately, we want to change system level circumstances, and that is largely policies. And so our work together is really to move the needle on that end. So again, thank you all for being here with us today. I am going to pass it back to Kara, who's going to get us started on our agenda. And again, just a pleasure to be with you all doing this important work. Thank you.
Thank you, Dr. Barnes. And thank you all for being here. I see that a lot of you have started to do introductions in the chat, and so I thank you for doing that. And just as a little icebreaker, if in addition to your name and your organization, you can just share who you think is going to win the Super Bowl on Sunday, since it is the holiday upcoming. So that is what the icebreaker will be. I see Team Bengals. We'll figure out who Healthy Living Matters folks think the winner will be at the end of this meeting. So let's see. And I would like to, at this time, introduce to you our keynote for this meeting, who I'm very excited is joining us today. Dr. Christina Economos. She's a professor, the New Balance Chair in Childhood Nutrition, Dean for Research Strategy, Director of Child Obesity 180, and Division Chair of the Nutrition Interventions, Communication, and Behavior Change at the Friedman School of Nutrition Science and Policy and the Medical School at Tufts University. Her research efforts have addressed the interaction among nutrition, physical activity, body composition, and health within a systems context toward the prevention of early childhood obesity. As the principal investigator of large-scale research studies, her goal is to inspire behavior, policy, and environmental change to reduce obesity and improve the health of America's children. Having worked effectively with diverse communities, she has crafted, implemented, and evaluated whole of community obesity prevention studies throughout the US, and is currently serving as the vice chair of the Roundtable on Obesity Solutions at the National Academies of Science, Engineering, and Medicine. So we are so happy to have you, and I will stop sharing and allow you to share your screen.
Great, thank you so much, Kara. So let me share my screen. Okay, can you see this okay? Great. Okay, so as Kara said, I'm Chrissy Economos. So nice to be with you today. And I have a lot of slides. All the slides have citations on them, and happy to share them after if people are interested. I know it's being recorded as well, so you could go back and see them. So for the agenda for my part of the talk, I want to share the current trends in childhood obesity, and specifically a lot of papers that are coming out with respect to the impact of COVID. Now with about 2 years into the pandemic, we have a lot of information that I think is really important for all of us to be up to date on, because we are going to live with the consequences of lockdowns and the disparities that we saw play out over the last couple of years for decades to come. So our programming right now and our policies are extremely important. I want to share our own work, Catalyzing Communities, which is our initiative at Tufts that we're so happy to be partnering with you on, and tell you how it came about and what we're working on now, and then move into the future opportunities with you. And then I think I'm handing it back over to Kara and Selena, who are going to talk specifically about the partnership that we have and what will be going on together. So starting out, just so we level set, we have an obesity problem in the United States, as we do worldwide. These are data on children and adolescents 2 to 19 years of age from our NHANES data set, which is our national surveillance program, where we direct measure height and weight, so different than self-report. And of course, you know that over the past 50 years, the slope is pretty steep. We have a lot of noise that's happened over the last decade or so when a lot of different initiatives have occurred. We had quite a bit of hope with 2 to 5 year olds, new changes in the WIC package and childcare policies, and pediatric practice appears in the last round that it's gone back up. And we have the highest rates among 2 to 19 year olds, as expected, when they're moving right into adulthood. And then we see the rates much higher throughout the adult years. But for all ages, we're hovering around 20%. And the story really is incomplete unless you look at these data by different variables. In this case, we're looking at it by race and Hispanic origin. Excuse me. When we look at the data by socioeconomic status, by geography, we really see a different picture as well. But just to remind everyone that that 20% is deceiving, because if you do look at children by their race and ethnicity, you see that the rates are quite different, with non-Hispanic Asian children hovering around 10% up to Mexican American and Hispanic children over 25%. So knowing the context that we work within and the populations that we're serving is really important with respect to knowing the starting point and what types of strategies are more likely to be effective in different populations. So I want to share some COVID-19 data. I have a few slides from some different studies, and to be honest, they all really tell us a very similar story. These are electronic health record data from about 100,000 children across the US. And you can see that the change in BMI, which is on the y-axis, was pretty steady from January 17 to January 2020 in the different age groups. But then you're looking at the period from the first year of the pandemic, where you see a much higher change in BMI in all age groups. It appears to be the highest for kids. We're saying about 6 to 11 years of age. These data are stratified a little bit differently, but you can see these children from 5 to 13 having a pretty dramatic change in BMI during that first year. These data are from the CDC, and they're part of the MMWR report that was put out at the end of 2021. So it's also electronic medical records, a database that is gathered from across the United States. And these are January 18 to November 2020. So again, close to the end of the first year of the pandemic. And the reason I wanted to show you this slide is because the children are stratified by their starting point of severe obesity in the darkest line, moderate obesity, overweight, healthy weight, and underweight. And you can see that also this is BMI on the y-axis. And you can see that overall there's a trend going up, but it went up the highest in the children who started with severe obesity. It also went up the highest in this case in the 6 to 11 year olds. So again, just noting children who are most likely struggling. You know, children 6 to 11 are in very structured environments in the elementary school years, recipients of school meal programs, structured physical activity through physical education classes. They're often attending after school programs. So they have a whole lot of structure presented to them. And when they were not in school or even in hybrid situations in lockdown for periods of time during this interval, there probably was a lot less physical activity and unstructured eating. This is a new systematic review that came out because there have been so many studies that have been published in the past 2 years looking at weight change, BMI change. So these are from a systematic review where they actually stratified the kids by children with obesity, children with type 1 diabetes, and then the general population. And you're looking at the right at the sort of weight loss and weight gain. And you can see overall that it's almost all of them have weight gain. And so right here, you're looking at body weight during lockdown, and before lockdown, and then the mean difference. And overall, we're seeing weight gain in all of these studies, whether the children are starting with obesity or they're in the general population. The change in obesity from this same study shows the same thing. So you're looking here at the odds ratio, in this case, all moving toward obesity increasing. Only one study showing a decrease in obesity. And again, these children are anywhere between 6 and 18 years of age. So looking at what's causing it, we don't have good data yet, and it's going to be a bit before our NHANES data comes out with our national dietary intake data. But this is a slide from some colleagues in South Carolina who had the opportunity to look at children's habits during the pandemic. And they had data on children before the pandemic from spring 18 to summer 2019. And then they were able to capture these same data again during that first year of the pandemic. And what they did see is that sedentary behavior went up and that light and moderate to vigorous physical activity went down. And they also saw some interesting trends in dietary intake where they didn't necessarily see a substitution, meaning that an increase in unhealthy foods and a decrease in healthy foods. They saw the trend for healthy foods, although it's a small amount of food that's consumed, stay consistent, but an increase in the unhealthy foods. So what that tells us is an overall caloric intake and probably coming from more unhealthy foods that were consumed during this time period. These are interesting data. These are from adults, but it's looking at decrease in physical activity using app data, where some people have on their smartphones, and these are de-identified, captured from a large swath of the population, again, from the beginning of the pandemic, just through June 2020, but from the major cities, and Houston is actually here. So there were over 4,000 people in this data set from Houston that have this app. And, just to really bring the point home that physical activity decreased dramatically at the beginning of the pandemic and probably has stayed lower for a lot of people throughout the past 2 years. So we know that obesity is a really complex problem, and some of you have probably seen this diagram before. It comes out of the UK from a group called the Foresight Group, and in the very center here, you see the words energy balance, which is the very oversimplified way to look at our balance in energy and weight, where it's energy in, energy out. We all know it's much more complicated than that, with quality of food and metabolic variability in the body. But just to say that there is this loop inside all of us that's metabolizing food and that is expending calories, and it's impacted by hundreds of variables that surround us every day. And these fall into the individual psychology area, to social psychology like marketing, food production, all the way out to the food system and imports, food consumption, physiology, and then individual environmental physical activity. So we could be working on one small thing within this system and not see any change in biology, or we could be working on multiple things in this system and collectively have an impact. And I know the work that all of you do, trying to target multiple variables within this system in order to have that kind of an impact. And we're excited to continue to work with you on identifying which are the variables that are likely to be most impactful given the context that you're working in. So we often talk about obesity as this complex adaptive system, and I know in the past couple of years there's been quite a bit of adaptation, including excess weight gain in a lot of the population, which is going to impact cardiometabolic risk, but also just metabolism in general. And due to this varied interacting and emergent factors that we see within and between individuals and their environments, there's a lot of influence on the balance of energy intake and energy expenditure. So it is quite complicated, and we don't want to get overwhelmed, but we want to be strategic and evidence-based when we make decisions about where to focus and where to put resources. So there's been quite an evolution in obesity prevention research, where 30 years ago, most of the literature was really focused on individual behavior change. And that's still very important, and we can do that in lots of clinical settings. It's hard to do at the population level. So we had about 20 years ago, excuse me, quite a bit of attention given to policy and environmental interventions that were helping us understand how to reshape our environments so that people could live a healthy life without the intense individual behavior change going on. That sort of grew into studies that were multi-level and multi-sector. And as Dr. Barnes said, I led one of those studies called Shape Up Somerville about 20 years ago. And we know that if you put a lot of things together collectively, you have a bigger impact. And that's really grown into what we call whole of community system science approaches. And we're going to talk about that a little bit today, where we have more sophisticated computational modeling that we can do, where we can try to predict and forecast which types of interventions are most likely to be effective in different settings. We can also analyze, for example, social networks, how diffusion of information moves across a community, the speed at which it moves, the intensity of which it moves. And then we can also look at how people are interacting together and making sense of the complexity. And we use things like community-based system dynamics, group model building, so we can actually externalize our mental models and see what an environment looks like and where we might have the most impact. So we've really evolved a lot in this space, and I'm excited that we're working together on a whole of community system science approach in your area. So in the past 2 decades, we've also had a lot of multi-center trials that have been funded by NIH, and they've been done by seasoned investigators. They've really been excellent. But unfortunately, many of them have failed to alter the trajectory of weight gain in high-risk populations. And we know it's because the social conditions in communities where these trials are conducted are really complex. And without community engagement and co-creation of interventions and really understanding the community you're working in, it's really difficult to make these changes. So we know that building community capacity is important, but insufficient to really work against some of the adverse community conditions that people find themselves living in. So our work, and you'll see as we talk about it more, is really helping to build community capacity and work to improve the social and economic resources that surround individuals. And we know that we have to strengthen and scale up the most effective strategies while combining complementary interventions and giving these strategies time to work. We spend a lot of time thinking about disparities and using a framework, which I'll present in a moment, that really gets at some of the deep leverage points or drivers that are causing disparities in the first place. So Shariki Kumanika, who's been a colleague of mine for over 20 years, developed this Getting to Equity framework, and we're using this in all of our obesity prevention trials. And it really speaks to the fact that the top part, which we're used to thinking about, increasing healthy options, is where a lot of the literature comes from. If you change what's available and you put better policies in schools and you have a healthier environment where people can play and be active together, and transportation is available to people so that they can use active transport, we can make people healthier. But if we fail to recognize that there's this force also behind it all, which is pushing unhealthy behaviors, then we're not going to have as much of an impact, like the higher cost of healthy food or the marketing promotion of unhealthy products or threats to personal safety or discrimination or social exclusion. So we're thinking about really the top 2 quadrants a lot when we do more traditional physical activity and nutrition interventions. But on the 2 bottom quadrants, I think is where the innovation is actually happening now. So thinking about obesity prevention, building in the variables in these 2 quadrants to go just beyond simple community capacity with empowered communities, but to think about strategic partnerships, entrepreneurship, and promotion of healthy behaviors at the community level, and also improving social and economic resources like anti-hunger programs, economic development, legal services, education and job training, and housing subsidies and tax credits. Because without basic foundational, what I think some of us would call everyday benefits, it's extremely hard for those top 2 quadrants to be put into place in families' lives. So we know based on the evidence that we have to date, there are a lot of key strategies that do work to prevent obesity and improve health. And you can see them listed on the slide here, and I'm sure they're familiar to all of you. But I want to emphasize that without those two lower quadrants being worked on as hard and those deep leverage points in the system being addressed, it's very hard for these things to take root and be effective. So our project, Catalyzing Communities, is really about community transformation. And it's, over 2.5 decades of work that I've done across the country, really trying to understand how to do this work comprehensively. So we work with communities to transform the way that communities across the country work together to prevent obesity and reduce health disparities. And we're working to create what we're calling a paradigm shift, which is, again, the way people think about health equity and obesity prevention, recognizing the complexity and building on community strength to improve health and well-being for all children and families. So these are our current partners, and we're so excited that you've come on board. You can see that a lot of them are on the eastern half of the country, but we're really excited that Arizona and specifically Tucson and you're in Harris County and specifically East Aldine are part of what we're doing now. So we started in Somerville years ago, and I took on quite a few efforts after that in 2005 to 2010 to try to replicate what we had done. And we had a lot of success and we learned a lot. We then went on to work with the Let's Move initiative and Mrs. Obama and the Partnership for a Healthier America to launch what we're calling Child Obesity 180 1.0, where we had 4 initiatives that we replicated across the country, and they were focused specifically on physical activity, the school breakfast program, eating healthy in restaurants, and marketing to children. And through those initiatives, we ended up reaching about 12 million children. So now we're back in this iteration of our work to the whole of community approach, really learning or taking our learnings from our scaling to the 12 million kids and our initial learnings from Shape Up Somerville and combining it with system science. And so these communities who have been working with us the last couple of years or are new to our portfolio like you are really helping us develop the science and also having impact on the ground that we believe will be scalable. So just a couple of slides on the original Shape Up Somerville that really informed all of this. It was a whole of community, multi-level, multi-systems approach to childhood obesity that took place between 2002 and 2005. And we involved everyone in the community, and you'll see a systems map in a moment that really illustrates that, in order to impact the health of 1st through 3rd graders. So it was the school, and that included everyone from teachers, the administrative staff, to the children themselves. We used all of the local media in the community, local government, the home, which of course are caregivers, parents, the child, the community. We engaged with restaurants, different ethnic groups, after school programs, and then the healthcare system. So it was really designed to be what I would call a surround sound. Every environment a child would move through in this community was part of the intervention, giving the same consistent theory-informed, evidence-based messages. And the results of that study were pretty amazing in that we did decrease BMI-Z score in children and obesity prevalence in children, and we had a spillover effect in the parents. We decreased sugary drink intake and screen time, and we increased sports activities, healthy restaurant meals. There was an overhaul of school food and competitive foods. There were many community-wide policies that were put in place and are still in place today, and then things like additional farmers markets and gardens. But what I'm most proud about is this work has been sustained in this community, and it's gone on to inform national efforts. And the Somerville team has continued to put out reports showing a decade of the work, or even beyond that, up to 15 years of the work. And then when Mrs. Obama announced her Let's Move campaign, the mayor of Somerville was one of the 2 mayors that was called to the White House to help her with the announcement. So really, I did a lot of the behind-the-scenes science, and he, as a mayor, was a partner of mine who was able to be a public face and really go on to lead a lot of mayors in the country to be inspired to do similar work. The other thing that happened in this study was a return on investment. So I partnered with health economists at the Centers for Disease Control and Cornell in order to look at whether or not the impact we had would soon return money to the community. And you can see prevention costs money up front, but it does begin to return. And it was about the 6 or 7 year point where you could really see the ROI coming. And this is very typical for a prevention study. And we all know it's a pay now, pay later model. And I think you'd agree that paying now is beneficial from an economic perspective, but even more beneficial from a quality of life perspective. So we have to make the investments in children and families now, unless we want to continue paying extraordinary rates within the healthcare system for decades to come. So this is what the dynamics of community change look like in Somerville. So this is a systems map that shows you all the microsystems that are present in really any community you would go to in the US. So you see the individual child at the top and their own energy balance loops. And that is impacted by all of these microsystems that surround the child: the family unit, the built environment, the school system, the food environment system, the media system, and then the community at large, which might include things like after-school programs and the healthcare system. But what's really important about the work we did in Somerville and the work we're doing with you is this brown note at the bottom where you see they're called the Shape Up Somerville Task Force. These were people in the community who were working with us every step of the way to design, implement, evaluate, and to sustain the efforts. And you can see the strength in the middle of this Shape Up Somerville Task Force was really the heart and soul of this entire project, which really led me to dig deeper into coalition science and to really try to understand what does it take to do community engagement well, and how can we replicate that across the country? And that's the work that you're a part of. We've also done a review of other obesity prevention trials that have gone on in the US that have used coalitions in their work. So the top one, Economos et al., is Shape Up Somerville, and one of our publications from 2007 on weight change. And the others are similar types of studies that happen throughout the US where community engagement was a key component, and there was an established and active coalition throughout the entire study. What's different about these studies, if you look on the x-axis, is the number of community engaged research phases that the coalition was involved in, from problem identification to sustainability. And you can see that the studies that used more of the research phases were more likely to have a positive outcome. So working with you, starting with problem identification, which is happening right now, we plan to go all the way through evaluation, dissemination, and sustainability, and hopefully this partnership can last for years to come. But we believe it really is a very intentional and deep effort with community engagement, which is an entire science in itself. So the work that you'll be engaged in came out of a large NIH grant called Compact that happened after Shape Up Somerville, when we started to explore more the system science and community engagement and coalition component. And it was called Childhood Obesity Modeling for Prevention and Community Transformation. And it involved a lot of academic institutions in the US and some partners in Australia and New Zealand who were doing very similar work. And the hypothesis here was that stakeholder groups may be a driving factor in the success of interventions through a process that we've called stakeholder-driven community diffusion. So this work really helped us to understand and leverage existing systems within a community to implement an upstream approach to obesity prevention. And when I say upstream, I mean working with a dedicated group of stakeholders or leaders in a community who can work with us on problem identification, design, diffusion and implementation, evaluation, and sustainability. So this upstream component really involves this stakeholder-driven community diffusion component. This is what the whole model of stakeholder-driven community diffusion looks like, and we've published this. And right now we're in the process with you. We've just convened, and now we're moving toward this group capacity and activities component. This will happen for a few months. Then diffusion and collaboration will occur, which will lead to hopefully changes in policies, practices, and environments with the ultimate goal to change child health outcomes. So you can see when I said upstream, I was really talking about this upstream part with the dedicated group of stakeholders or the coalition we'll be working with in East Aldine, which will hopefully gel into a very effective group that starts to work on diffusion and collaboration and ultimately have midstream and downstream outcomes. And we're dedicated to all of these core pillars in the bottom: responsiveness to community context, capacity building, evidence-based programming and practices, and trust among stakeholders and community, among other things. Historically been part of efforts in Harris County, and those who are already participating and excited for a new way of working. And it's a new way of thinking. So a big part of this project is systems thinking. It's really helping people to see things in a more complex way, but to break it down into action-oriented steps. So it's first important to understand the whole system, and then it's important to figure out within the system where are the leverage points and where can you have the most impact. So we're interested in systems thinking, equitable child obesity prevention strategies, and data use and evaluation. We also work on networking and connections. People will be participating in our learning collaborative and networking with coalitions across the country so they can really learn from each other. We're providing fiscal support and positive community impact, we hope, by sharing the high impact, sustainable, evidence-based strategies that are primed to succeed. So again, showing you our current communities that have been working with us for the past year or two. You can see they're working on community linkages and coordination, early childhood development, advocacy, youth mental health, after school and school-based physical activity, use of federal nutrition programs more strategically, nutrition security, and so on. We wanted to just give you a sense of what some of these communities have prioritized. It doesn't mean they're only working on these things, but they have really deep concerted efforts to work rigorously on these things. So I'm going to stop there. Thank you. I hope that was a good introduction to the work that we're doing, and also hopefully if you haven't been following the literature closely, what's going on with childhood obesity in terms of the impact from COVID-19. And I'd be really happy to take a few questions. I think we have about 10 minutes.
Thank you so much, Dr. Economos. So I see there's one question in the chat from Dr. Barnes, and she asks, do these new numbers undo the gains that were made in childhood obesity prevalence 5 years ago?
So, I mean, I can't say for sure, but I can tell you that of all the studies that are out there now, and there are quite a few, I mean, the MMWR is national, so I think that's really important to keep in mind. The systematic review, they were smaller samples. They're varying lengths of time, and they are, varying numbers of kids. So the data are consistently showing, a 2 to 5% increase, but in some communities it's showing even higher. So in general, I would say it looks like it's moving in that direction. I would also say, and I didn't show it today, but I've seen some data emerging that show it's even worse in communities with disadvantage. So I'm afraid to say it's possible it not only undid some of the gains, but it made it dramatically worse. So I think we have to keep our eye on the data that are coming out. A lot of kids were going consistently for their annual well child visits, not all of them. So I think we're going to see more and more data coming out as kids start to be seen again. They're back in school, the school nurses are able to see what's going on. So I don't want to go on record of saying that we've reversed all of the gains, but I think, unfortunately, I think we have a lot of work to do in the next few years if we're going to help kids who are still, within adult, I would say, care, and we have the opportunity to get them to age 18 at a healthy weight, or to try to prevent adult obesity with, secondary versus primary prevention. And I think we all need to double down on the efforts right now. And I know USDA is working hard on school meals. As you know, they're free to everyone this year. And, fingers crossed that remains that way. I know there's going to be some changes with eligibility. Even in community, if it's not free for everyone, there's going to be some eligibility changes that might make it free for more children. And that's a good thing. School meals are protective. We need to focus on physical activity. There's no question. And then, to go along with that, there's a lot with social and emotional learning and mental health. It's a big part of the picture. It's not just what we eat and how we move. It's how kids feel about themselves, their connections, their self-esteem, their self-efficacy, and a lot of damage has been done in the past couple of years from what I'm seeing and reading. So it's a tall order that we have, and I think there's a lot of work to do. And those of us who have a voice in the policy space need to be loud, because these are policy and environmental things that we need to be working on. I'm just looking in the chat.
Oh, yes. So the question that actually just came up was related to what you were just talking about, those who are in the policy space. Do you feel community engagement or leadership engagement, like mayors or principals, is important in this type of effort?
Yeah, that's a really good question. I've had experience with that going both ways. I don't want to say too much about elected officials and politics because I'm not an expert in the area, but I can tell you my experience is if someone is dedicated, boy, do they have a lot of power. They can make a lot of things happen. And, mayors I've worked with who believe it's health in all policies and who believe, to build a strong community, we have to invest in children and we have to invest in their health. It goes a long way. It doesn't take away from the other work going on. It strengthens the other work going on. But I have also experienced where people are trying to get reelected or their priorities shift because of other reasons where it can actually cause damage because they pull away from the issue. And if the issue was too aligned with that individual, when they pull away, the effort can collapse. So I would say it's very context specific and it's leader specific. But when I've seen it works really, really well. And I can tell you in Somerville, where the mayor just decided to not run again after almost 20 years, he sustained those efforts, and it's a pretty amazing place to live now. It's not without problems, but the policies have been sustained. The structural issues that he worked on have changed a lot. And that's a legacy he's leaving behind. And there have been a couple of really nice case studies written on him that talk about the legacy. The mayor of Nashville years ago did the same thing with walkability and bikeability in Nashville. That didn't go away. They didn't come and, change the bike paths. They're still there. So there's some real important structural things that can happen that will live on. And those are important investments.
The next question was related to Somerville.
Yeah. And I have, the mayor is still local, and I want to ask him, but interestingly, there was a case study written by the Harvard Business School, and I was interviewed for it. I want to get my hands on that. That's about his mayorship overall. He did a lot more than health, but it did have a big piece in there, and I'm really interested how the Harvard Business School people wrote about it. So I'll try to get my hands on it and send it to you. But, he reallocated resources. There's no question. I mean, he made Shape Up Somerville an integral part of the community with paid staff. It wasn't, can people volunteer and come to a meeting and then go back to their regular work? There were paid staff. There was a paid pedestrian and bike coordinator who was part of the city budget. There were policies in place to incentivize people who worked in the community. So there were real tangible things that happened in terms of policies and reallocation of resources. And I think that was a really big part of it. And then it attracted more like-minded people. So that's a big part of this. And that's how social networks work, is you're going to start to attract more people who feel and believe the same thing. Any other questions or thoughts? We'll be sharing data back I should have mentioned that, which is a really important part of the work that we do. You know, we're not going to hold data for 5 years and then tell you when we're ready to publish it. This is an iterative process. And so it's important to frequently look at data, and we'll do that with the leadership we're working with, and then understand how to iterate based on that. And, you know, just to reiterate, the work is being done by all of you. We're partners, but we're not here to do anything to take over or to tell you what needs to be done in your community. That's coming from you. We want to be experts who can be helpful in the process and partner with anybody in the area who'd like to work with us. But this is really a ground up process.
Well, thank you so much, Dr. Economos. Does anyone have any final questions or comments for Dr. Economos? I know that she's going to have to leave.
Thank you so much for letting me speak with all of you, and I hope you'll see us as a resource in the partnership. And as I mentioned, if anybody wants the citations, well, you know, I'm happy to share those if you want to look at the full articles. But I'm going to stay hopeful that we can all make change together. So thanks for being a partner in this and for having me with you today.
Thank you so much. We're so happy that you were able to join us, and we're happy to be
I'll stay on for a few more. I'll stay on for a few more minutes. Thank you.
Okay. I am going to actually hand it over to Dr. Barnes now to introduce our next speaker for our movement activity.
Great, thank you so much, Kara. So it is my pleasure to introduce you to one of my dear friends, Sandra Organ. She was Houston's first Black ballerina, and she's also the founder of a dance company, Earthen Vessels. It was a contemporary ballet ensemble that promoted, educated, and diversified audiences for dance during its 6 seasons. Sandra continues to be a choreographer and a movement instructor professionally, and she's led movement workshops across generations. She offers you a moment to stretch, move, express, and embody some of the I Have a Dream speech by Dr. Martin Luther King Jr. as a communally empowering experience of Black History Month. Kara, are we able to highlight her image on the screen so that she's the center and everybody can see her?
Spotlight.
There we go. That's perfect. So I introduce you all to Sandra Organ. Take it away, Sandra.
Well, good afternoon, everyone. You've probably been sitting in a computer chair. If you want to try to get up and stand and move and get a little stretching happening with me, I welcome you to do that. Of course, everybody needs to kind of turn off their mics, and you can even turn off your picture if you want, but it's kind of nice to see people and that they're moving along with me. So we're just going to go through a couple of things. First, I just want to start with you're just getting your fingers moving again. If you're going to stay where you are, just getting those fingers stretching and kind of get out of your dream state. And you have a nice little moment where you have so that's our I have a dream when he says that every time. And then we're just going to start doing this. Yeah, you can do this sitting in your chair, or you do it. So that's the sign for day, you know, like on an hourglass. And then we're going to get our shoulders moving a little bit, just forward and back a little bit, jangling this cord kind of thing. We're also going to do a couple of stretches up. So let's just take our arms up overhead, take a nice big inhale, and then just drop it down to the bottom, like you're playing safe, right? Here's another one. So I'm going to go through these moves in a minute, but I just want you to kind of get things ready to go. So just a nice upper body circle is kind of nice to do when you're sitting in front of a screen all day. Maybe give yourself a little bit of a yawn there. There'll be some specific things. So here's one, just drawing that line across you, making those Rough place is plain. Yeah. And the crooked spaces, can you just kind of do that business? And you're getting your hips moving, so that's kind of warming up your hips. Do a couple hip circles while you're down there, one way or the other. There's a whole section coming up about faith, so I'm using this sign, like just a kind of a communal sign for faith or spirit or heart center. And those parts we'll use that will hew out stone of hope from a mountain of despair. We'll use the hope sign, which is this. Yeah. So from your chin up, and it keeps your eye up. You can do it on either side. We'll also do it toward the end. It's the truth sign. So you want to cut through the middle of your hand, and then it's almost like you're putting it in this, you're looking at it through a bow and arrow. Let's see, I'm going to look one more place. There's a particular section that comes up pretty quickly, and it's with this faith, we will work together. Just get that going in your hands. Pray together, come back to here. Struggle together. Go to jail together. If you want, you can go ahead and put those behind your back, because that's usually how they take you to jail, right? I don't know. Stand up for freedom together. If you feel like you put your hand up, you can make a fist. Knowing that one day we'll all be free. The last section goes into this whole thing, one day that we'll all be part of God's children. So this is that. So you want to circle your own face. Yeah, we're all God's children. And I sing, I use this one in church a lot. It's just like hang loose, put together, making a trumpet. And then there's a part where it's talking, my country 'tis of thee. So what I think about is that this, my arm is like I'm the swaying of the flag. Yeah, just my arm, my elbows moving back and forth. And when he says land, you just kind of go land. That's where my fathers died. That's the sign, ASL sign for died. And then we go land of the Pilgrim's Pride, like you're putting the pitchfork in, American Gothic. And then from every mountainside, you're gonna reach up to one corner or the other, you're just gonna sway back and forth and kind of become the Liberty Bell. And the land, then we're gonna become the eagle, yeah. If America wants to be a great nation, this must be true. You're gonna go true, and you're gonna take aim. Okay, so you've learned most of the things, so I'm just gonna go along and start the dance with us. Now, if you wanna get up and really do it, you're welcome too. So I have a dream today that one day, every valley, so we're gonna bend our knees, look down, shall be exalted, turn over those palms, look up. Every hill and mountain, so there we are in that nice mountain pose. And we're gonna make it low, so quick. And the crooked places, so we got the rough places first, so make that sandiness plain. Then we got the crooked places. Crooked places, we're just gonna stand up straight, made straight. And the glory of the Lord, make a little sound, and then you throw that open. The glory of the Lord shall be revealed, and all flesh, that's us, shall see it together. And then look out. This is the faith which we return to the south with. But I'm just using his words. With this faith, we will be able to hew out of the mountain of despair a stone, just like a big circle, like hope. With this faith, we will be able to transform the jangling discord of our nation into a beautiful symphony. I'm playing that of brotherhood. Yeah, playing the violin. With this faith, and here's the fast part, we will be able to work together, pray together, struggle together, go to jail together, stand up for freedom together, knowing that we will all be free someday. This is the day when all of God's children will be able to sing with new meaning, "My country, 'tis of thee, sweet land of liberty, of thee I sing. Land where my fathers died," and it's the land of the pilgrim's pride. From every mountainside, let freedom ring. If America is to be a great nation, this must be true. Okay, you've learned the dance. We're going to do it now with his words. Follow along as you can. I think it's a beautiful thing to be empowered and embodied. Is that okay?
Every hill and mountain shall be made low, the rough places will be made plain, and the crooked places will be made straight. And the glory of the Lord shall be revealed, and all flesh shall see it together. This is our hope. This is the faith that I go back to the South with. With this faith, we will be able to hew out of the mountain of despair a stone of hope. With this faith, we will be able to transform the jangling discords of our nation into a beautiful symphony of brotherhood. With this faith, we will be able to work together, to pray together, to struggle together, to go to jail together, to stand up for freedom together, knowing that we will be free one day. This will be the day. This will be the day when all of God's children be able to sing with new meaning, "My country, 'tis of thee. Sweet land of liberty, of thee I sing. And where my fathers died, land of the pilgrim's cry. From every mountainside, let freedom reign. If America is to be a great nation, this must become true."
Good job, everybody. Blessings. That's all I have to offer you. May you go with that empowerment of those words in your body for the rest of your session today. Thank you.
Thank you so much, Sandra. That was beautiful. I can tell you're a professional dancer and many of us are not, but it was great to move our bodies with you and to hear those inspiring words. So really appreciate you joining us today and not only getting our bodies moving, but getting our spirits and our minds moving as well. So thank you.
You're very welcome. Continue with the good work that you guys are doing in our communities.
All right, back to you, Kara.
Great. Okay, thank you so much. That was great. I didn't even realize that how it would feel, but I just feel great after that. Thank you so much for that. And I'm going to share my screen again. And this is the moment where we're going to talk some about the East Aldine Healthy Living Matters new collaborative partner. Let me just get there. So just to recap, for those of you that have been involved with HLM over the years, you are aware that we have focused in target communities based on what data says, and then also the partnerships that are available in the communities. So in our first iteration of our work in the community action plan, we worked with Cashmere Gardens near North Side and also Pasadena So I'm just highlighting some of the collaborative efforts that HLM had as a part of that, those efforts. So in Kashmir, something that HLM was involved in, just in some plans initially when HLM was at the table with Kashmir, it was suggested or in a plan to have a community garden that met at the Kashmir Gardens Elementary School. And so a couple of years ago, that did start. It started at Kashmir Elementary and is now evolved and is now taking place at the LBJ Hospital Farm every first and third Saturday. So if anyone is interested in partnering with that garden or just patronizing it, I encourage you to do that. That's just a picture from one of the recent farmers market events. And then in near North Side, the HLM was instrumental in partnering around the Go Neighborhoods plan that was in place there. And we continue to be a part of the Greater Northside Health Collaborative. And during the pandemic, we were able to participate and do an advocacy presentation for that collaborative. And they're still very active and different efforts that are ongoing. So if you are interested in partnering with them specifically, I definitely encourage you to do that, and we can put you in touch with any of those groups. And then a lot of you are probably very familiar with Pasadena, and these are some of the accomplishments that or successes that happened as a result of the collaboration in Pasadena. So one of the major partners who was able to really make some of the things that were identified as plans for the community was the MD Anderson Group with the Pasadena Vibrant Communities Initiative. And so from that and through collaboration of the Pasadena Task Force, there were playgrounds that were built, walk and bike to school days happened, and a safe routes to school plan was put in place in collaboration with the school district and the city of Pasadena. And that culture of hosting bike to school days and walk to school days is still ongoing within the district. So it's really great to see that. And then certain streets, some of the structural changes in the community got upgraded as a result of some things that were identified through collaboration. The school district was, or the community was second and third place winner in the statewide It's Time Texas Community Challenge, which was great. School gardens were added, tracks have been built. And this is not saying that, HLM built these things, but it was we were at the table in bringing the issue of childhood obesity prevention to light and educating partners and seeing who is at the table that, would be able to help impact these things within the community to put in place education and structures that allow families and students to be able to make healthier decisions for themselves in their own community and to have healthier lifestyles. And so I just wanted to take a moment to hear from one of the partners who were a part of the Pasadena Task Force, to just share briefly his experience and just any words of wisdom going forward for our new collaboration. So Raul, you want to unmute?
Yes, good afternoon, everybody. Thank you for allowing me to interject a few comments on my experience and perspective of being involved in HLM here in the Pasadena area. I joined back in 2014, and the biggest thing that the comments I wanted to bring was, yes, the city of Pasadena has adopted several of these initiatives, but the main partner, Pasadena ISD, really implemented a lot of these initiatives immediately. And as you can see on this slide, they have been participating and continue to drive a lot of the work within the school district with the kids. now that the Parks Department has taken over the HLM initiative, they are created, they used the initiatives and created a master healthy parks plan that incorporates a lot of trails and walkability to places to walk to in our community. So that is there, that is going and continues. They also are working on a Vince Bayou Greenway trail system that's going to connect City Park from the north side to the center of Pasadena. That's going to be able to improve walkability and connect the communities with a community garden that they're going to be building along the bayou also. So there's a lot of initiatives going on, and also the city is also coming on board when they select a street to redo and reconstruct for drainage improvements, and they're adding sidewalks, and they're looking at streets like Llano Street that they just approved CDBG funds at their city council meeting to be able to connect a sidewalk in that community along that street to an existing trail that the city of Pasadena has along the Vince Bayou that connects their main park, Strawberry Park in the center, to their park in the south, which is Burke Crenshaw Park. So there's a lot of great things that are occurring, and a lot of those initiatives that they've adopted from HLM are really still making an impact in our community. So that's the comments I wanted to share with everybody, that it is worth it, all the hard work, and continue to strive to move our community forward. Thank you.
Thank you so much, Raul. It's great to hear that work is continuing on. So now we'll talk about, so during the strategic planning, it was decided that we should 100% continue to partner with communities. So we went through a process of looking at the data to see what communities in Harris County had, is there a need? And of course, as a lot of you probably know, there are many communities in Harris County that have high rates of childhood obesity or adult overweight or obesity. So, we started talking with different communities. Aldine was one of the areas that was on the list, as well as a few others. And in the conversations and things that we had with the partners who were there, they were very interested in partnering, and there was a lot of energy there. So it didn't make the decision too hard. But as you can see, some of the data from the Health of Houston survey that came out for the 2018 data shows that the Aldine area was higher in the 38 to 42% range for children with unhealthy weight. And then some other information about just chronic illness, inactivity, unhealthy behaviors, comparing that to the county versus numbers in East Aldine, they're also higher. So one factor was the data. And then, as I mentioned, looking at the partners who are there. So they have a lot of health promoting assets in East Aldine, such as Baker Ripley, Hope Clinic, the East Aldine Management District, who are all very interested in partnering around some sort of health-centered collaboration. The Livable Centers study that just came out in 2021 that they did with their community liaisons. So there shows an interest, community interest, that they have an interest in health promotion, and they see it as an issue that needs to be tackled within their community. And then the school district is definitely an asset. They have a very robust family and community engagement department that's always wanting and willing to partner to provide services and care for the children in their district. The PE department, there are a lot of leaders in like PE and health teachers who are leaders in the state. And then they have a garden in the child nutrition department and a program called Learn, Grow, Cook, where 4th and 5th graders rotate through on a field trip to sort of like a farm to table experience where they're able to work in the garden and then cook something with the chef. So that's what that is a picture of. So those are some of the assets. This is the location of East Aldine. But at this time, and this is the meeting that we had with Hope Clinic. I'm sorry, I totally skipped over that. So in December, early December, we had an initial engagement meeting with East Aldine partners in collaboration with Hope Clinic, and we hosted it at Baker Ripley. And there were several stakeholders who came and were very engaged and excited about the collaboration. It was a great meeting, great energy. So that's what that picture is there. So we definitely look forward to continuing to partner and hoping to start meeting regularly in March. But I wanted to just quickly have you hear from Selena Valdez, who is a lifelong resident of East Aldine and the Precinct 2 Community Liaison, who is one of the key leaders in partnering with the Healthy Living Matters East Aldine Collaborative, and will also be the community change maker in the Catalyzing Communities work that we're doing. Selena, are you here?
Yeah, can you see me? I turned on my camera. Hey, everybody. My name is Selena Valdez. I am Harris County Precinct 2 Commissioner Adrian Garcia's community liaison for the East Aldine area. I can't tell you how thrilled and how fortunate and how blessed we are to be able to join this collaboration. No greater investment can be made in some of the best people in the whole country. East Aldine is a fabulous place. It's a great place to live. It's a great place to work, and it's becoming a wonderful place to play. But we do have our issues, just like everybody else. And I'm looking forward to working as hard as I possibly can to make sure that we implement these changes, not for just today, but changes that are going to be lasting for generations more than just now. We're talking about building a future for the best people in the country. So thank you so much for inviting me. I'm excited to join this fantastic journey, and I'm looking forward to getting to work. My sleeves are rolled up. I'm ready to go.
Thank you so much, Selena. So it has been great working with Selena and the team from Tufts. And we have started the problem scoping phase of the work that Dr. Economos was talking about in her presentation for the systems dynamic approach to community collaboration. So we're very excited to be a part of that and to have East Aldine be represented and a part of this national initiative. So that's what I wanted to share, what we wanted to share about that collaboration. If you would like to be involved and partner specifically for the East Aldine task force, we don't know what the name of it will be yet officially, but for the collaborative effort in East Aldine, please feel free to reach out. You can email the info@healthylivingmatters.net, or you can email me directly if you would like to be involved. So moving on in our agenda, we would like to welcome Joel Romo. who is the Legislative Committee Chair for Partnership for Healthy Texas, and also the Vice President of Governmental Affairs with the Cooper Institute, and he will be giving us an update on some of the interim activities and ways that we can be involved during this interim time when there's no session this year. And I will stop sharing and allow Joel to share.
Well, good afternoon, and thank you everybody for allowing me to join you today. Always good to be with you and be part of this program. Wish we were all in person. I think I was with you guys before the world ended, probably back in 2020, early 2020, I think. So in Houston, if not, it was that year before. Always fun to be here with you and visit. Can everybody see the slideshow before I keep going? Yes, no?
We see you, but we don't see the slides.
Okay, let me try something here. 1 second here. Make sure. Okay, how about now?
It looks like it's coming up. We see your email.
Are we good?
Well, we see your email. Here we go. Partnership for Healthy Texas.
Okay.
There you go. Perfect.
All right. Sorry for a little delay there, but again, my name is Joel Romo. I am the Legislative Chair of Partnership for Healthy Texas. We've had the opportunity to work with your team over the years on various policies and enjoy the partnership. Just a little bit of who, we're made up of over 30 organizations, all focused with the goal of addressing childhood obesity. And you can see the number of partners there, and that's just a sample of some of our membership. Some of our leadership there, obviously our chairs, Dr. David Lakey, our vice chair is Clayton Travis of the Texas Pediatric Society. And you can see some of the other folks there on our leadership team. And our mission is to develop and promote state policies that prevent and reduce obesity. And we've been in existence since about 2006, 2007. And as a collaborative effort, we've been able to address numerous policies over the years that address childhood obesity, everything from PE, and of course, playing a lot of defense and preserving some policies at the state level. We've been able to advance some nutrition policies and food access, and we'll go into some of those in a minute here. But our coalition and membership, the way we work and we develop our policy priorities, it's a fully engaged process. We survey our members to discuss related issues. We use data from our partners and research to formulate and recommend policies. Our steering committee weighs the political feasibility of proposals, and we give the status of what things look like at the state level. And obviously, with an election on hand, we will go through all this over the summer as we start developing some of these strategies. During the past session, this was our priorities for the 2021 session, and we derived this list of priorities based on that process I just shared. And we hope all of you with your respective organizations, if you're not part of the partnership, we'd welcome the opportunity to visit with you and learn more about your organizations and the partnership and figure out ways to work together. But and thanks to Healthy Living Matters and other key groups, we were able to advance to recess policy, which would have encouraged more recess in schools. Every session we get that bill across the finish line or right there, and it just gets, political dynamics work against us. But, I'm sure we'll be back. Some of the priorities were to increase PE and health, fund surplus agricultural programs, encourage initiatives to address social determinants of health, improving SNAP access for seniors, promoting and protecting the whole child school health policies approach, protect health education, and protect chronic disease prevention funding at Department of State Health Services. And so we use this document to educate lawmakers before the session, during the session, and as the process went through. And here's what our successes were as a result of the session that just adjourned this past year. Senate Bill 224, signed by Senator Perry and sponsored by Representative Wally in the House, signed into law. Surplus ag products grant was fully funded, protected the funding for fitness gram, chronic disease prevention. We worked on school health advisory councils. There was a lot of things thrown at school health advisory councils this session. Some of them were trying to abolish them completely. Some of them were trying to mix them into some areas of that they shouldn't have been. While it wasn't ideal, there are some changes that, and we can get into that later, to the school health advisory councils that were done at the last minute within conference committee that that I think we're now it's a little bit more reporting and recording that we just weren't able to slow down. And we were able to educate lawmakers on chronic disease issues related to the issue of obesity and tried to get more support for future efforts. And also some of the additional projects that we lent support or worked on or helped raise awareness was the bill, Senate Bill 2248, that relating to the selling of e-cigarettes, which now requires anyone that sells e-cigarettes to obtain a permit from the state, increases the penalties for those selling the tobacco products or e-cigarettes to minors, and that passed. Prior to that, there was anybody could sell e-cigarettes and didn't have to have a license or a permit. We were able to get the Office of Health Equity legislation addressing social determinants of health, thanks to Representative Garnet Coleman out of Houston there, passed out of the House, died in the Senate, never received a hearing. And then also another bill that we were able to get out of the House relating to a pilot project to improve healthcare outcomes and reduce costs under Medicaid by providing participant recipients with enhanced case management and other services. That died, but there was a lot of discussion, a lot of thoughts into future efforts. And as mentioned earlier, moving forward, while the legislature is not, we do see the opportunity to educate lawmakers as they get ready to come back in January of 2023. We'll see some interim work that will start happening, I'd say most likely after the March 2nd primaries. Some of the committees will have hearings on issues. And we also, as a partnership, have already started meeting legislative committee and as a whole committee to target lawmakers that we could possibly spend more time with and help them become champions of our issues. We'll go in a little bit about some of the proposals that we submitted. The House and the Senate request suggestions from their leaderships, and committees on issues they should look and study at during the time that they're not in session. And we, the partnership, work with our membership and develop some priorities, and we'll get into that in a minute. And I mentioned we're looking at cultivating some champions. With a couple of those successes from this past session, we want to build on that and have a bipartisan approach to get more of our policies passed, preserve some of the issues that constantly come under attack. So it's going to take all hands on deck, and we hope that some of you will join us and help us. We're going to highlight a couple of the interim issues that we submitted to lawmakers for consideration. We worked and submitted these to different committees in the House and the Senate. The House had a deadline, I believe, of November, sometime in November, where they had to receive all the recommendations, and then they had to turn them into the Speaker. The Senate has, I believe, a March 4th deadline where they will receive to Lieutenant Governor's office interim recommendations. And so we're working to get champions to get our recommendations, these interim study proposals, into the hands of leadership and hopefully get some interim hearings over the next year. First one there that we targeted, the House Health and Human Services Committee and the Senate Health and Human Service respectively, was looking for opportunities for Medicaid managed care organizations, healthcare providers, and communities to partner and to implement non-medical initiatives that address social determinants of health, to help patients be healthier and more productive at home and school, and also help containing Medicaid costs. We provided one-pagers with these to each office, kind of a little bit of the science, the rationale, and on some of these, projected cost savings, because the lawmakers are always looking at the budget in 2-year intervals, since the legislature meets only every 2 years, of how we can save money. So we hope to get some support in that. The other one we did, which I think each of you here has heard the stories during the pandemic, was the reduction in physical activity. So we're looking for the legislature to study and assess the impact of COVID-19 on physical activity, physical education, dietary intake, and obesity, and how it impacted raised some obesity rates in our children. We're also asking them to look at how school meals, physical education classes, and other opportunities for physical activity were impacted, but how we can learn from that. And this is a good time to demonstrate the importance of staying physically active and fit, whether it's a pandemic or just overall, in the sense of, it can be correlated to academic success, it can be correlated to behavioral health, et cetera. So we've got a couple of committees that have expressed some interest in talking to staff, and we hope to be able to visit with them before when they have their official hearings in the coming months. Another one dealing with the better treatment was one we submitted to the House Insurance Committee and Human Services in the Senate, was to identify and study the availability of obesity treatment, management, and care options that are not covered by Medicaid or state employee health insurance plans. This had a lot of support from different partners, not only the just cross-section of folks that were working on this and pushing this. Insurance industry, healthcare, some pharmaceutical groups are all looking at how can we make sure there's access to these issues, but also that they're covered by insurance and Medicaid plans. So we're looking, again, optimistic that this will have some support. The partnership did provide testimony to the House Public Health Committee in October of this past year relating to an access to healthcare in communities near the Texas border. Our testimony highlighted the high burden of obesity near the border and the potential solutions to help address and prevent obesity in that region. And so, these are the opportunities we're looking for. And so as committees hold hearings, your team here at the Partnership for Healthy Texas will engage volunteers, our leadership, and make sure that we get in front of these folks. And here's where you can come in. Our next steps in terms of the interim is, as I mentioned, we will identify opportunities to engage with these interim hearings. We'll continue building relationships with lawmakers from both sides of the aisle and key stakeholders. We're always looking for new partners that may not be at the table, or somebody we may have overlooked that could help us open the door to key lawmakers or help us with the votes, because all this is about vote counting. At the end of the day, when the legislature's in session, you need a certain number of votes to get a bill out of committee. You need a certain number of votes to get a bill out of the House. You need a certain number of votes to have a bill brought up in the Senate. So the partnership has been very successful as a collaborative team working together. And as these interim opportunities exist, we'll be doing visits with lawmakers in district, whether it be Houston, Dallas, El Paso, South Texas, North Texas. And we can let people know if they're interested in joining us and visiting with lawmakers and taking folks with us to visit with them and sharing and educating them on these issues. We are currently starting the process regarding developing our policy priorities for the 88th regular session, which convenes in January. We will have a full coalition membership meeting sometime in June of this year. Not sure how that's going to take place. Everybody's getting comfortable with the virtual, so it may be a virtual meeting. But we are looking for people to join our efforts and to get involved. And folks, the legislative session is not far away. Here we are in February, and by November, second Monday in November of this year, legislation will begin being filed. Budget hearings will begin probably about the same time as they craft the budget for the next biennium. Legislative agendas will be set. And so, we plan to have our legislative agenda set by September, so we can start shopping it around and getting bills drafted and getting budget priorities in the legislative appropriations request. But we welcome your engagement. If your organization or you personally have some relationship with key lawmakers that could help us advance some of these, we are welcome welcoming you to the mix. And there's our contact information there to sign up for. You can go to our website and sign up for emails and find out additional information. You can apply on behalf of the organization to be part of the steering committee for the Partnership for Healthy Texas. So with that, I will stop and see if there are any questions, or if not sure on time how we are, but happy to open the opportunity.
Thank you, Joel. Does anyone have any questions about how to get involved during the interim session? If not, I have a question. So I'm just wondering, what is the best way to talk to our local elected officials? So as a citizen, you know, if I am passionate about childhood obesity prevention and want them to be a champion for some of those issues that you mentioned, some of the priorities that you laid out, what's the best strategy in doing that? Like, do we have a role in creating champions, or do we need to identify them?
Absolutely. You would have thought I asked you to ask that question. You teed it up for me. You know, that's the best way to get lawmakers involved, is getting folks locally to go visit with them about the issue they may be passionate about. If it's PE, nutrition, food access, or just overall sharing with them how current programs are successful, whether it be our school health advisory councils, and you have a success story. They may not know about it. So it's a great opportunity to meet with them while they are in district. They really appreciate you talking to them now while they have the time, sharing a little bit about your work with the organization you might be with, or if you're a parent or just a concerned citizen, you're going to get more time with them right now versus coming to the Capitol in February when they've got 30 people outside their door trying to get in. It's a good time to share your concerns. You can use resources of the partnership. You can use, you know, any of your respective organizations have, you know, priorities or some issue documents that you could share. Go make that appointment. And if you end up having to visit with the chief of staff or key, you know, advisor to that lawmaker, don't feel disappointed. During the session, those staffers spend more time with lawmakers than lawmakers spend with their own families. So they're going to relay your concerns, your message. So it's old grassroots. Reach out to them, set up a meeting, take somebody else with you, have that visit, do a follow-up. We've got folks right now that came in from El Paso, and we took them to the various lawmakers' offices at the Capitol and from their respective town of El Paso. Man, we've got some good relationships going on, some good things happening based on that volunteer coming in, going to the Capitol, visiting with the staff, and now that office is engaged with some of the partnership's priorities.
Thank you. So we can all definitely get involved. And I definitely encourage all of you to do that. Get to know your elected officials, or let them get to know you. That's one of my goals for this year, is to be more engaged with those who represent me. So I've been sending a lot of emails in my not working time, telling them what I think about different things. So I encourage you all to do the same, because that's—
Let me be clear on your elected officials. It's important that you reach out to your school board, your city council, county, legislative, and federal folks, because they are all going to be voting on some type of policy that impacts, the whole child, whether it be joint use issues, nutrition policies at schools, or PE at the state level. As Karen just mentioned, it's a great time to get involved, and we're happy to coach you along as well. If you don't feel you're alone on this, if any of you would like to reach out to the partnership or us and myself, happy to spend a little bit of time with you on the phone and helping you prep for that meeting. So, and of course, we're going to want to know how to go. What can we follow up with? That's how the legislative process really works. It's really a very hands-on process. And so we encourage you to take part, as been mentioned, and get to know your elected official.
Well, thank you so much, Joel, for joining us. We'll definitely stay engaged and look forward to continuing to collaborate. And I know we're going to have announcements. We're almost getting to the end of the meeting, but I did just quickly want to share that on March 4th, it's Obesity Awareness Day, or World Obesity Day. And Live Smart Texas is hosting a statewide summit virtually, and the Partnership for a Healthy Texas will have a panel discussion during that session. So I encourage you all to register for that and be a part of that and promote it within your own networks as well. And I can share the link in the chat unless someone else has it handy.
And I do want to give a shout out to Allison McCourts with the Partnership for Healthy Texas and the Texas Pediatric Society. She's helped us put this PowerPoint together and keeps the partnership running. So thank you. And thank you again for the opportunity to be here today.
Thank you for being here. All right, so continuing on in the agenda, we are almost done, you guys. So we're just giving you some updates of some progress that has been made since our strategic plan debut, which was what we talked about at our last collaborative meeting last year. So just quickly gonna run through some of the progress that we've had. So you heard from Dr. Economos at the start of the meeting about the Catalyzing Communities initiative. So during the strategic planning process, we had this opportunity come across our desk or across our emails, and we talked about it, and all of the points within the request for proposals, we just kept saying like, oh, we need this for Healthy Living Matters and for communities that we collaborate with. So we applied for the partnership opportunity, and we were accepted, and we've started having different trainings and meetings with the Catalyzing Communities team from Tufts University. And I'm happy that two of the people that we usually meet with weekly are here, Julie and Mary, if you guys want to wave. Hi. It's been a great opportunity working with them. We have a great working relationship, so I'm very excited. But something that is exciting as well, that being a part of the Catalyzing Communities initiative, is that Healthy Living Matters, and because it's in Harris County, the greater Harris County area has access to being a part of the Learning Collaborative. And so we feel that that goes to the goal, one of the goals that were identified in having Healthy Living Matters be an innovative hub for childhood obesity prevention initiatives, research, and best practices. So we did share out when we had the first learning collaborative opportunity in November, I think it was. And so those will be ongoing throughout the year as we continue to partner. So we'll definitely share those out with all of you. We hosted the Shack convening in the fall. That was also in November, and which is part of working towards that goal of being supportive of Shacks and helping to build capacity around their school health policy and different changes in their school districts. So we had 74 people who participated in that, and they represented 23 different school districts in our area. We even had someone from like College Station who was also on the call. So that was great. And then, as you all heard, we have identified a new HLM priority community, and that is East Aldine. And we had our initial meeting with partners in collaboration with Hope Clinic in early December. And the Tufts team was able to come and meet with some of our partners. And as I mentioned earlier, we have a goal to start meeting in early March, to start regularly meeting in March. And I would like to hand it over to Lucy, who is our early childhood health outcomes manager at Harris County Public Health. You know that HLM has had a great, worked hard in the early care space over the years. And so Lucy is going to provide an update of what is going on with that quickly. So I need to stop sharing again.
Yes, hello, everybody. I've been here behind the scenes, but let me go ahead and share my screen to share a little bit about what our program has been completing and doing this this first quarter. So can everybody see my screen on the echoes thing? Okay, so as Cara mentioned, I'm Lucy Martinez. I'm the Early Childhood Health Outcome Support Team Manager, so you can just know us as ECHOS. So the goal of the ECHOS team is to advance Harris County's efforts to improve health in the early childhood setting. This is particularly the early child out of school, so before pre-K, so anything before. And so I just wanted to talk about some of our accomplishments on Q1. Some of the things that we do is we think of ourselves and we promote ourselves as the right hand of the center directors and center teachers. Whatever they need, they can reach out and we'll figure out how to fund it for them. Anything from applying to grants, state initiatives they can participate, and providing free professional education and training credit hours. And so for quarter one, we reached out to 2,284 centers in the Harris County area, meaning that we either connected them with a resource or we reached them through our newsletter, and there was some sort of communication in Q1. We attended a few conferences because as childcare health consultants and Texas trainer registrants, we are able to present at conferences. So we provided nutrition education to reduce the obesity problem that we have with children. So we presented at the R.T. Garcia conference, the Educational First Steps, and the Natural Start Alliance. As I mentioned, the ECHOS team does provide a lot of professional education and a lot of trainings. Every second Saturday of the month, we do a training for any center director or teacher that needs continuing education hours and would like to log on a Saturday. So we had 75 total participants in Q1. However, in December, we only did a private meeting with our Acres Homes community, which is why our numbers are a little bit lower than they were in the past quarter. Alrighty, and so some resources provided. We also delivered trikes and helmets to some centers. We connected centers to free food programs, and we connected them to the free coaching by the Texas Workforce Commission. So we did a lot on the final quarter of the year. So we also participate in the Outdoor Learning Environment Initiative, which for anybody who's new or hasn't heard about it before, it involves an Prevent Obesity by Design model by revamping the outdoor areas of early child care centers to promote more gross motor activity. So we just want to thank the United Way of Baytown and Chambers County for installing the following elements in our Baytown sites. We received garden beds from them, an outdoor storage shed to contain all of the outdoor games and tricycles that we have, a bridge over the Dry Creek element at Church Women United, a beautiful library at Stream of Life Christian Center, and a double hill slide at Footprints Learning Academy so that children can play, climb, and slide at the same time. So last year, we've received a donation from Texas Tech University to incorporate a schematic design for Alpha Academy number 3 in Pasadena so that they can start the revamp of their outdoor space and incorporate more design elements that will promote gross motor activity. And this is what the plan for the Alpha Academy number 3 plan is. And I know that Raul, you were there at that meeting, so this is the final result of what it looks like because Raul joined our workshop introduction. And so as talking about OLE, I mentioned that it helps to implement different design models. And it is a number of 13 models that we try to implement to maximize the outdoor physical activity of the centers. And I wanted to share the last element at our Baytown site. Y'all have been keeping up? The Baytown site, Peter E. Highland, is complete with the majority of the outdoor elements. And I wanted to share their final one and a short glimpse on what it looked like, what it looks like now. I wonder if it'll play. Oh no, it's not letting me play. I will share it in the email link so y'all can see it. It's only about a minute long, but also for Acres Homes, that is our new community. So outreach was our biggest target this year. I mean, this past quarter was to engage the centers in wanting to participate in this initiative. And so we were able to deliver some gross motor activity elements like helmets and tricycles. And we met a couple of our center directors as well. And they're very excited to start working with us with this new initiative. And that was it for me. Thank you.
Thank you, Lucy. It's so good to see a lot of the work continue on with the early care sector. It's very important to, start engaging kids before they get to school. So thank you for all of your hard work on that. And we are getting towards the end of the meeting. So I can share my screen again, which just says partner announcements. So if anyone has any announcements of events that are upcoming that you want to share, please feel free to unmute yourself and share. Any announcements?
Well, hi, this is Steve Amos, and thank you so much for allowing me to be a part of this. I've worked with different folks throughout the years, Nonprofit Health Code, and I shared in the link an opportunity for folks that are interested in nutrition. If you ever had an opportunity to hear Dr. Joe Furman on PBS, he's amazing. And so we have a free session with Dr. Furman at noon Central Standard Time this Wednesday. Just want to be sure people knew about that. And later on, I could share more about Health Code's free virtual activity events. That could be a great compliment. We've worked with some of the school districts in the past. Thanks for your amazing work. It's very inspiring.
Thank you, Steve. Good to see you. So I put in the chat 2 events that are coming up. So I shared the link for the World Obesity Day Summit with Live Smart Texas, which is on March 4th. And then also next week is Action for Healthy Kids. The Texas chapter is hosting their annual summit. And so the link to register for that is there, and it's virtual. Usually it's held in Austin, but you guys know. So we are, so it's virtual this year. But I definitely encourage you to register and attend or share with folks who work with schools or who are in schools, because it's a lot of great information will be shared for SHACs and for school health in general. And something else to share for HLM is on World Obesity Day in the morning, we'll have an opportunity for partners or whoever would like to do a little workout with our exercise consultant for our department, and that is Jasmine Peterson Caleb. And she has done a lot of our activity breaks for Healthy Living Matters collaborative meetings in the past. And so she'll be doing like a full workout with you if you are interested, and we'll post all that information upcoming. Okay, and I see in the chat the first partnership for a Healthy Pasadena meeting for 2022. If anyone is interested, will be on Thursday, February 24th, 2022. If there are no other announcements, then this we can conclude the meeting. I encourage you all to continue to stay involved and updated. You can follow us on Facebook or Twitter, or check the website for different updates. But we definitely love to continue to partner with all of you. And someone, sorry, I'm just reading in the chat, someone has shared that if anyone is interested in receiving human trafficking certification, at no charge to reach out to Constance Jones. And Raul shared his contact information, and so did Constance. So if anyone wants to be involved in either of those initiatives, the Pasadena on human trafficking, you can contact them. And we'll share all the links and contacts in the meeting minutes that we send out after the meeting. So thank you all for being here and for supporting HLM. And I will give
Thank you.
Oh, sorry. The Bengals are the winners, according to our, the Bengals are going to win. But no Super Bowl definitely was one of the answers. And then honorable mentions were for winners were the commercials, and then also Snoop Dogg. So we'll see what happens on Sunday.
Thank you, everybody.
Thank you.